Okay, so today we're going to talk about something that I personally feel is not talked about enough, but is something really important. And whenever we talk about subjects like this, I always like to start with none of this conversation is meant to be scary. It's just meant to be informative for people who may have never heard of it or just need a little help if they're dealing with this situation. So today we are going to talk about diabetes and pregnancy, which, like I said, I don't think it's talked about enough. You were diagnosed, we were talking before we started hitting record, 23 years ago today.
Yes.
With that. So how
Wait,
old
what
were
did you call it? Your what?
Your
Diabursary.
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 Happy 23rd diabursary.
Thank
Yeah.
Thank you.
But is it something you celebrate or is it just like an acknowledgement?
I mean, my husband gets me flowers and a card every year. It's
Wait, which by the way, I feel like we could have a whole conversation about your
Our
husband on
husbands?
TikTok. So
Oh.
we won't do that right now, but I love your husband. I've never
I
met him.
need to follow
you
him
need
on- I've grown up with him.
Oh, you did?
I was
Yes, since I
actually
was
gonna
in
ask you
kindergarten.
guys
I grew
if-
up with her.
I was gonna ask
That
if
is
he
wild.
could come on with me because he's my biggest hype man and he has so much energy and passion about this whole entire subject.
Where
we
is he?
totally could have had him.
Is he at
close
work?
by?
Is he close by? Can he come?
We
He
totally
probably
could have had
could.
him.
Yeah.
Okay, so 23 years ago, you were how old?
12.
And how did you get that diagnosis? What were your
Pretty
symptoms?
textbook. Yeah, pretty textbook. I was already pretty skinny, but I lost a lot of weight. So, maybe I lost like 12 pounds in a week. And then I was super thirsty, like unquenchable thirst. So no matter how much I drank, I was just still so thirsty. I was really hungry. I was on the toilet going pee nonstop all the time. I was just super tired. I kind of looked like white and sickly, but I just didn't want to go to the doctor because I was like, you know what, this is just like a cold or something. Like, I'm fine. One day I like walk up the stairs to go to school and I basically just collapse on the floor. And my dad's like, Gina, you are going to the doctor today. And I went, they tested my blood sugar. It was super, super high. And they sent me to the hospital.
Wow.
Okay, so for context, you and I grew up together. I'm 1 year older than you. So I remember in fourth grade, you were always stick skinny,
Mm-hmm.
but just a little, small bone. You're still a fit, thin girl. It was I couldn't imagine losing that much weight at that age.
Yeah, it was crazy.
Especially in a week. That
I
is
looked like I was in a concentration camp. I'm not kidding. You could see all my bones. It was scary.
Wow.
Yeah.
So 12, that's very young to be diagnosed with such a big thing to take on. How were those first initial months of understanding your diagnosis and how life changes for you?
Yeah, honestly, my world was literally it was just turned upside down. I had this devastating diagnosis that was, changed the trajectory of my entire life, and I had to take on this huge responsibility of functioning as a pancreas that no longer worked anymore. So all the cool things that teenagers could do took so much more thought. I couldn't just snack on whatever I wanted or eat whatever I wanted or drink whatever I wanted or sleep in. Had to test my blood sugars at certain times and only eat a certain amount of carbohydrates. And so I think it just made me mature really young, and I became just super independent, and it was really, really hard.
because
really
it's
hard.
life or death if you don't.
Exactly.
It's not optional.
Yeah.
Well, I'm sure we've talked about this. Even a sleepover becomes difficult,
It really does.
right?
Yeah,
Things
my
that when
parents
you're
were
little,
not comfortable with me sleeping over at a friend's house for a long time.
until it was probably under control, if ever. It's never really fully under control. You just manage it better.
Yes.
So talk about the trajectory of your life. When you first were looking at getting pregnant, how was that changing your view of your body and your relationship with your body? And what did you think that was going to look like getting pregnant?
So I never really had a problem with the way that I thought about getting pregnant. I guess the examples in my life were just my mom, and she got pregnant very easily. So I was like, okay, this might not be a problem. Maybe diabetes isn't even a factor. But I guess I should preface this by saying that diabetes is what led me to become an herbalist and a naturopathic doctor. And so I feel like because of my medical background and how well I took care of myself, I always thought that even though I had diabetes, like I could have a normal, healthy pregnancy and labor and delivery.
Because of the knowledge that you had from being a naturopathic doctor.
Yeah. And just, implementing all of the knowledge that I have into trying to achieve near perfect blood sugars.
For people who don't have your background in medicine, like what do people misunderstand about diabetes and pregnancy, especially like right off the bat?
I think that they're kind of just scared about it. They hear from their practitioner or other people that have had bad experiences just the fear about having diabetes in pregnancy. And it's kind of different for type 1 diabetics, type 2 diabetics, and gestational people with gestational diabetes. Like at the end of the day, all of the risks that you hear about are valid, and they're valid with poorly controlled blood sugars. So if you don't take care of yourself and you don't have near normal blood sugars, like those complications do exist, and they do happen, unfortunately.
Were you ever told that when you enter into pregnancy that maintaining your blood sugars is going to be more difficult versus
Oh yeah. Oh yeah. In fact, when I was first diagnosed, they I don't remember the exact words they used, but I remember I was so scared and thought no one was going to want to marry me. Like, no, I'm not going to
when
have
you're 12,
kids.
you're saying that they were telling you these things?
Not, I mean, I because it was it's such a hard disease
Right.
that you don't see how hard it is because it's like invisible, right? It's really hard to manage your blood sugar during pregnancy because in the first trimester, you can have a lot of lows. And this is just from different hormones that happen. And then why people get tested for diabetes in pregnancy for gestational is during weeks 24 and 28. And this is really when insulin resistance starts to ramp up. And so in type 1 diabetes or pre-existing diabetes, you start to have to take so much more insulin. And like your insulin needs can change every 3 days, definitely every week. And you just like ramp up and your body becomes so insulin resistant that, for instance, if I were to eat an apple right now, I would take 1.5 units for that apple. But if I'm in my third trimester, one apple, I might need to take like 7 to 10 units of insulin for that.
Wow.
Yes.
And then you have the thing. So, okay, wait. I want to go back because you said T1D, type 1 diabetes, type 2 diabetes, and gestational. Remind me what you have. You have type 1 diabetes.
Yep, type 1 diabetes.
Okay, and for like kindergarten level, type 2 diabetes is
a disease of just insulin resistance. So with type 1 diabetes, it's autoimmune. So your body attacks the pancreas. So you're no longer able to produce any insulin. And insulin is what covers the carbohydrates and manages your blood sugar in your body. So that's why we take injections of insulin. With type 2 diabetes, often they're producing so much insulin, but their cells in their body are not responsive to the insulin. And what insulin does in your body is it tells the cells to take in the extra glucose or the sugar so your body can utilize that for energy. So in gestational diabetes, you can have a lot of insulin in your system, but your glucose is really high. And then you also become insulin resistant as well, like in type 2 diabetes.
So if you have gestational diabetes, are
Mhm.
you taking insulin?
So I would say majority of the time you can manage gestational diabetes with diet and lifestyle.
Finger pricking. Okay, two of my girlfriends have had this, and I will
Mhm.
say, like, the two girlfriends of mine that have had gestational diabetes are like fit,
Same.
healthy, like
Same.
eat very clean. Like,
Half my
Yes.
size.
it made no
Yeah.
sense.
Yes.
So, because I think one of them was actually in wellness, so she was
Mhm.
really embarrassed by it because
Mm.
she's like, I am the poster child of wellness. I buy wellness companies. Like, this is like, she was mortified. Like, how could I have this?
Yes, yes. I would say gestational diabetes does not discriminate. You could have someone with all the risk factors for gestational diabetes. So, overweight or obese at conception, they're non-Caucasian, they're over the age of 25, uh, they have family history of type 2 diabetes or gestational diabetes, and they actually don't end up getting gestational diabetes. Then on the opposite side of that, you can have like a triathlete. I'm talking like the most fit woman ever who eats perfect and exercises all the time, and she ends up getting gestational diabetes. So
Wild.
yeah, it is pretty wild.
Okay, so a woman that has either Type 1, I keep wanting to call it T1D because
You
of
can
that
call it,
security.
yeah, you can
So
call it
type 1
that.
or type 2, what should she be thinking of before trying to conceive?
So I would say you could by yourself or work with your doctor, telling them that that's your goal and having them give you some advice on what, like what kind of A1C to look for. So A1C is a test, a blood test, and it shows what your 3-month average of your blood sugar is. And for someone living with type 1 diabetes, they want that number to be below 6.7. And someone with type 2 diabetes usually, in my experience, is they sit pretty high. Their blood sugar is pretty high. So they're going to want to just, at the end of the day, you want to have near normal non-diabetic numbers before you conceive. And then this just translate throughout the whole entire
Okay,
pregnancy.
we had an MFM on, Dr.
Mhm.
Perlow, and he was talking about like preconception diabetic is so important because
Yeah,
of the
like
numbers.
seeing your OB preconception if you are diabetic is one of the most important things you can do.
Yeah, I would agree with that, but in my own experience and working with people, I have seen crazy numbers like before they knew they were pregnant, and then when they find out that they're pregnant and their A1Cs have been like off the charts and they've been sitting at like 300 and 400 and they end up having like perfectly normal babies.
Wow.
So it's just, but then some women, are at the other end of that spectrum and have perfect blood sugars and can still have some issues with their baby. So everybody is different. You know what I
Right.
mean? So,
Everybody and every baby.
yeah,
Yeah.
truly,
Yeah.
truly.
What do you wish practitioners tested more or talked more about when it comes to markers or blood work for preconception or even during pregnancy?
So I think with gestational diabetes, I do think that early testing is beneficial because that first trimester, a lot can happen and go wrong as far as like genetic defects and malformations. That's kind of like the big scary thing with having high blood sugars in that first trimester. So early testing is great rather than waiting for that 24 to 28 week testing. Because a lot of the times, like if it's something as scary as a malformation or a deformation, like that's already happened during that
Right.
Well, and what's so
development.
crazy is you don't even go to the doctor until you're 8 weeks pregnant. Like the baby's halfway, like all the organs are there by what, like a 10 and 11 weeks. Like you're going at the tail end of that.
Yeah. Yeah.
And when you're saying to test earlier for gestational diabetes, are you saying in even women who are not pre-diagnosed with diabetes, like just normal women, like you think we should be tested earlier?
I do. I do. I think you should have some sort of just basic blood work run when you're thinking about wanting to start a family.
Yes. I always thought it was interesting that we wait until like the very end of pregnancy to test for gestational diabetes. You're like, wait, I'm literally on my
A lot
way
of doctors'
out.
offices are getting better at this, and they are testing like a fasting blood sugar and your A1C. So my midwife, she will test the A1C in the first trimester, and if it's above a certain limit, then she starts aggressively treating them with diet and lifestyle recommendations.
Okay, so can we have to talk about the drink. I feel like we can't not
That's
talk
so
about the drink.
gross. Yeah.
So my first
yeah.
pregnancy, I was like, I don't want to say conformist, but I was like doing what I was told to do for
Sure.
the most part. Like there was things that I pushed back on that I'm very happy that I did, like the COVID vaccine or Tdap. Like there were things that I decided for my body that no, I'm not going to do
Oh, I
that.
thought you were saying you did that. I was like,
Oh no, I didn't.
so
What do you-
nice for you.
No, but like otherwise, I was like, okay, yes, I'm coming to do that. Sure, like nodding my head. Then when it came for the drink, I was like, oh yeah, like I've heard about this. Like I'll do the drink and then prick my finger. But with my second, I feel like it was like I became a little bit more informed. I just more knowledge and research. And I told my doctor, I don't, and I actually had a different doctor at the time than I did for my first, but I said, I don't want to drink that stuff. Like, isn't there an alternative that I could do? And he said, absolutely. He's like, eat this bar or whatever, like
Mhm.
something, and then come in an hour and I'll poke your finger.
Yeah.
He did it right there for me. And he's like, you're good.
Yeah.
And
I
I'm
love
like,
him.
why don't I love him
I love
so
him
much.
so much.
Like our doctor's Dr. Illick. Like he's delivering her baby actually in 30 minutes.
Not mine, my
not your
sister's.
baby.
Yeah.
Her niece.
I'm here.
It is your
not
baby.
having a baby.
But he was a much more, I feel like, progressive doctor
Mhm.
than like everyone else is like, just drink the stuff. And like, can we talk about that drink?
Yeah. We can talk about
Is
that
it
drink.
needed?
It's not needed, but if you have a high patient load, it's just easier to like there's a practice in place, you follow it and
It's a
boom,
system.
it's done. Yeah.
Got it. It's
Uh-huh.
an ease of a system.
But
Okay.
if you are willing to ask, they should provide you with other options.
Yeah, I
Like
was
in
shocked.
midwifery care, a lot of times they don't even do oral glucose tolerance testing, like at all.
Wow.
What do they do?
You can do at-home finger pricking and
Okay.
you can test your A1C. Like they can send out for blood work. It's easy peasy.
Interesting.
Yeah.
I want to get into your birth story and everything in a second, but just going off of like midwifery and you being a naturopathic doctor, like in your opinion, in what ways does a naturopathic doctor complement an OB or an MFM and like what they're doing?
So I don't know what exactly it complements. I would say naturopathic medicine really empowers the patient to take their health into their own hands. And when any doctor sees that in you, they're they kind of like hold the reins a less tight. You know, they're like,
Mhm.
okay, this person's got this. Like they understand. And in the context of diabetes with naturopathic medicine and how that would complement that is we really or I give my patients like the tools to have great blood sugars. They know what is affecting their blood sugars and they really become experts in their own health. And when you're working with an OB or a perinatologist and they see this, you know, why would there be any resistance?
Right.
Or why would there be any treatment like a like you should have the same treatment as a non-diabetic woman if you have near normal blood sugars.
Are you finding that women with diabetes are going more towards a naturopathic route or are they
No,
scared and
not at
sticking
all. I
more?
would say it's
I
a
was going to say, I yeah, that
small
they'd be more afraid, right, of going
yes.
that direction.
Yes, definitely.
So,
And there
what do
are
you say
very
to
strong
women with
opinions.
diabetes that are afraid of going the naturopathic route when you've had so much like success in that area?
You mean naturopathic in regards to like a home birth situation
No, I think
or
just in treating diabetes in general and maybe through pregnancy. Like the way you've been able to manage your blood sugars without the Western medicine, maybe full beliefs.
I would say shop around
Yeah.
with different doctors and find someone that's really comfortable working with someone who has pre-existing diabetes and wants to get pregnant and is able to work with you and see you through and what you want for your birth experience to look like,
Yeah.
knowing that at the end. So there are great resources, and I feel like there's a lot of power in community, and the diabetic online community is amazing. There is a Facebook group for that's all about natural birth and type 1 diabetes, and I think a lot of great
I have a
questions are
question
asked.
with that. Okay, natural birth with type 1 diabetes, is that higher risk?
Yeah, any kind of diabetes during pregnancy, you're automatically high risk.
So when you're delivering, is it like home births are out of the question?
Yes,
But
Except
did you
for
do
you?
one?
I did. Yeah, both of them were
Both
at
of them
home.
were home births.
Hmm.
So did you have a midwife?
I had a midwife.
Okay, can you tell us about that?
I know. We were talking about it before you
Oh,
got here. Then I was like, wait, I have to stop talking to
yeah.
Okay, so
Okay, so wait, you had an OB and a midwife or just a midwife?
Okay, so for my first birth, I had an OB and a midwife, but my midwife wanted the OB who Dr. Stuart Fishbein, who does the home birth breach, and he had taken a client on a year before who was a type 1 diabetic living out of LA, and she had her fourth baby at home. And I was like, when I heard this, I was like, oh my gosh, this is possible. This is something I can do. So he actually sent me her number. We had a good chat on the phone. And then when I was trying to Google just different midwives in the Orange County area, they all said no.
Oh,
They
wow.
all
Oh,
said
that's
They
no.
trigger the
interesting.
liability.
But I found one that got back to me and she was like, I'm totally willing to work with you. And yeah, so.
What could go wrong in delivery with when you have diabetes?
Okay, there's a lot. So the risks are that you have a big baby. So that's like one of the big myths is like, oh, you have diabetes, you're going to have a big baby. And this can be true a lot of the time, but again, that's if you don't have good blood sugar control. So just because you're diabetic doesn't mean you're going to have a large baby. Like for instance, my first baby was 7 pounds and like 9
Oh,
ounces.
yeah.
and my next one was like 8'4", maybe.
Average.
Totally normal
Yeah.
size.
Yeah. Yeah, but a big baby today is anything over 8'13", which I feel like isn't even that big. I mean, the biggest baby in my midwife's practice was like 15 pounds. Non-diabetic.
15 pounds?
Yeah, 15 pounds is her
My insides hurt
Oh,
hearing that.
yeah.
She did a home birth?
a home birth.
No epidural? Oh my God.
Vaginal.
Where is
yeah.
that woman? And bring her on the podcast.
Yeah, she deserves
And obviously
medal.
from my background and stuff, I always ask women how they delivered their baby and whatever. And there are so many like small little women that have delivered 10-pound babies, no problem.
Yeah.
Wow.
Letting your body do it.
Okay, so big babies are one of the risks during
Big
delivery.
babies, yeah, big babies, which increases the risk for shoulder dystocia. So
Okay.
dislocated shoulder in the vaginal canal, which can lead to neurological damage in the baby. And then also, birth trauma for the mom,
Mhm.
emergency C-section. The baby could have dangerously low blood sugars at birth. And this is because the baby is inside your womb and you, as a diabetic, have slightly or a lot higher blood sugar than normal. But your baby inside, because glucose sugar crosses the placenta, your baby is exposed to all that blood sugar. But their body is compensating by constantly producing insulin to control that high blood sugar. So as soon as the baby is out of your room, umbilical cord is detached, they're still pumping out that insulin. So that could send them into a low blood sugar or hypoglycemia. And this can obviously be dangerous because low blood sugar is not great.
Wait, so how do you manage that at a home birth after delivery?
Well, it's not very black and white. Like I had my baby, my first baby that was born, she had a perfect blood sugar. My second one had a low blood sugar, but I had donor milk on hand. And just because you have a low blood sugar, it doesn't mean that they're having any effect from that. So they also have to show signs of hypoglycemia. But depending on where you give birth in a hospital setting, they might see that low blood sugar and automatically start treatment. So that's like formula or oral or IV dextrose solution. And
What's
but
dextrose solution?
it's just pure sugar.
Oh,
Yeah.
geez.
Yeah, pure sugar.
Wow. Okay.
Glucose, yeah.
Wow, so you're like, okay, I don't want that for my baby.
Yeah.
Yeah,
Maybe
no.
not right in the first
But
step.
I did at home at the home birth. I would heel prick my baby for like the first 24 hours of life. So sad, but
You had to make
yeah,
sure
I had
that
to, and it's the same thing they would do in a hospital.
Right.
Yeah.
I was going to say it's the same
yeah.
thing.
And after those 24 hours, the baby's blood sugar is completely normalized, and this is just a normal adaptation after pregnancy.
Is there anything that they do different? And we're looking at your birth, which is a home birth, maybe different than, a diabetic woman in the hospital, but anything they do different during labor for you? Like, are they checking things differently? Are they handling your labor a little bit differently because you are diabetic?
Okay, so for me, in my case with the home birth, I managed everything. I feel like a lot of women that I talk to that give birth in the hospital setting, they prefer to manage their own like pumps or insulin and blood sugars. But in the hospital setting, they often don't feel comfortable with you doing any of that because they, for whatever
They need to
reason,
do it.
they need to do it. And this is where it gets hard for a lot of women because they lose that sense of control, but then
Mhm.
they're also like giving birth and they want their baby to be safe. So
Right.
they're kind of stuck between a rock and a hard place.
Interesting.
What lifestyle changes should a pregnant woman with diabetes make other than testing your insulin? Like other than like, okay, I've got to test this. Like how do you manage your diet? And is there something outside of diet, like with exercise that somebody with gestational diabetes should do?
I think the easiest thing that you could incorporate is just small, brisk walks after every meal. So 10 to 15 minutes, that lowers your blood sugar.
Everyone should do that.
I know, right?
Right.
My trainer
Yeah.
tells me that all the time. He's like, you would do wonders to what you want to do if you just walked for 10 minutes after you eat. Literally
Mhm.
every meal. He's like, just go 10
Oh my
minutes.
gosh.
And
Who's going to do the dishes?
And I don't have time for that. I don't have time for a 10-minute walk.
It's also like decreasing your stress because
Yes.
stress, produces cortisol. Cortisol increases your blood sugar. So maybe that's like deleting social media and
Mm.
stop watching the news. Just stop doing stuff that is stressful. Stop like being on your phone so much. I always recommend just like technology breaks.
Unplug.
Mhm.
You recently unplugged.
I recently
Why'd you
unplugged,
unplug?
but I'll probably plug back in.
I was gonna say.
Yeah.
Well,
I
by
was
the
like,
time
I
this
can't
comes out,
find
you'll be
Gina.
plugging back
Where
in.
are you?
Okay, so I recently joined TikTok, and it's nice because I don't have any friends that I know, so it's not like I know, Susie from 6th grade, and I'm looking at the birthday party. I'm sorry, we were
Yes,
just talking about
totally,
birthday party, but
totally.
I don't like need to. I don't need
There's
to
not
know all
compare
of
it's
Yeah,
that.
it's more
yeah.
just like fun news.
Yeah, it's
Yes.
Yeah.
fun. It's
I feel like
fun.
that has to be like you have to have a lot of self-control to be able to do that though. Like
It
to
was never like a
unplug.
big deal for me ever.
Yeah.
I was never like addicted to it. So, I don't
Not
post a
addicted, but
lot.
like I'll like look at it like at night or like I mean, don't get me wrong, I probably check like Instagram like 3 times a day.
Yeah.
But then like my husband doesn't have one and he'll be like, oh, he'll look at my Instagram and he's like, oh my God, like this person did this. I'm like, you watched all the stories. Now I won't know who did anything today. And I'm like, what am I saying? Like, who gives
Yeah.
a shit?
Yeah.
Like,
Yeah.
and it takes time. And it's like, and also like you're comparing yourself to things. Like it's just a very unhealthy
Honestly,
relationship.
that's
It really
probably
is.
some good advice for just pregnant women in general.
Yeah.
Just to unplug
Yeah.
and maybe listen to the Camp Chaos podcast.
Yeah, there you go.
You're
Yeah.
spitting
Yeah.
Yeah.
And
real
another
information.
huge part of that though is diet, and that's like food pairing. Just remembering that pregnancy is temporary, and so this like huge responsibility of achieving really good blood glucose control, I mean, should stay with you throughout your whole life if you have pre-existing diabetes, but for gestational, like it's a temporary thing majority of the time, and restricting yourself from certain foods or food groups that you shouldn't eat that elevate your blood sugar is only temporary.
Yeah.
You
So
know what
let's
I
talk
mean?
carbs because I feel like this is important. Like during pregnancy, like all I wanted was carbs, a croissant, a
Your whole
pasta.
pregnancy, or just that first trimester when you're
It was
feeling
more with
disgusting?
Zoe when I had a girl,
Yeah.
and it was more like in the beginning.
Mm-hmm.
But so carbs when you have type or when you're gestational diabetic, like you can't eat carbs, right?
You
Or what's
can.
misunderstood
You
about
don't
carbs?
want to not eat carbs because carbs are energy. The baby also needs carbs to grow. So I would never put someone on like a zero carb diet ever. Um, it's just about like if we were to use a plate method, you want at least half of your plate to be fiber, so like non-starchy vegetables, so stuff that's not going to raise your blood sugar, like potatoes for instance.
Okay.
You want non-starchy vegetables, so and then you want a quarter of your plate to be protein and fat, and then the other quarter would be carbohydrates.
So just not even lower, just like moderate, right?
Yeah.
I think that's what
And-
we all should be eating instead of the big bowl of pasta.
Totally. Well,
Yeah.
and
And if you're gonna eat pasta, by the way, like don't do it at night when you're gonna be laying
Dormant,
down,
laying down, yeah.
for the rest of the night. Like that's not gonna set you up for good blood
Breakfast
sugars.
in the morning is pasta.
yeah,
A
so
big
like do it
bolognese.
for
Yeah.
lunch.
Yeah.
Little breakfast bolognese. Oh my God. Okay, so with both, well, let me ask about pre-existing diabetic women in pregnancy and their diet. How do you have to change it from how you were eating before you got pregnant to in pregnancy? Like when you were using the apple as an example. Do you have to change like, oh, I couldn't eat the same way that I was before? Is there a big change in diet?
I would say that there should be.
Okay.
Yeah. So instead of just an apple, I would maybe include it with like a nut butter to have a little bit of protein and fat to decrease that spike of just having the fruit sugar. So you see a more gradual rise rather than just like a shoot up and then a shoot down situation.
Got it.
So
You
like
have to
food
manage
pairings-
and think about
So
so much.
much.
Yes, you do.
While
Do you ever
feeling
have
like shit.
resentment of like other people that
There
can
are
just
days
eat?
where I have burnout and I'm like, I don't have resentment for other people. I feel so happy for other people. But sometimes I'm just like, I hate this.
It's exhausting.
It's
at
taxing
times.
for sure. But I love working with gestational diabetic women because I'm like trying to hype them up. I'm like, this is a blessing in disguise. Like you're learning more about food than someone would in
Totally.
their entire life, and this is going to translate into how you are as a mom, hopefully, and like how you raise and feed your family.
Okay, I want to talk about this. Tell us how to feed
And
our
then
families.
I get to see them graduate from diabetes. Like at the end of their pregnancy, majority of the time, they're
Yeah.
done having diabetes. So I'm like,
Yeah.
oh, good
It
for
was a
you. You're
lesson.
so lucky. I don't get that luxury.
You don't get that
you know
luxury,
what
but I also
mean?
feel like you sitting where you are as a naturopathic doctor and then also having this, it's like you forget about like just having the knowledge. Like, no, I walk this life. Like, I
Mhm.
know this life.
Yes.
So tell us what we should be feeding our families.
She's like, how much time do you have?
I know, right?
I feel like
Like,
it's-
I
it's
feel like a
so
lot of
hard.
kids eat beige food, like chicken nuggets, pasta, chicken breasts. Like, it's all beige.
It's true. So my kids don't eat off of the kids menu
Yeah.
ever.
Good for you.
Yes. Unless, I mean, it depends. Some kids' menus, depending on the restaurant that you go
Some are
to,
great,
are
yeah.
really good.
Elevated.
Yeah,
Like
like Osby's is
a little
great.
fillet
Osby's
or
is
something like
great.
that.
Nick's on 17th is amazing. They have salmon or a fillet. Have you done that one?
Yep, with carrots.
Osby on 17th is also great. But
Mhm.
yeah, I know a lot of these places are like chicken tenders, pizza, or a hot dog.
And yeah, and majority, like we live in a health bubble here in Orange County. Like you go to Middle America or anywhere else, and it's like that's all everyone eats.
Yeah.
Right.
You know, so I would just say the least, like, stay away from the processed foods, stay away from stuff that, like, the breads, the rices, and the pastas. I know it's like so, it depends on your culture and stuff like that. But if that's what you're eating all the time, it's not going to be good for your blood sugar or most of your
Just your
organ
diet in
systems.
general.
Yeah.
Yeah.
Okay, I feel like my kids were pretty good with this. Like when they started eating, I gave them like a lamb chop, like to start eating, like
Mm-hmm.
just put it in their hand on the bone.
Yeah.
And they eat salmon, like they'll eat like sardines, like they're adventurous eaters for the most part.
Yeah.
But then they see like other kids and what other kids are eating, and it like
Mhm.
ruins it.
Yeah.
And a lot of that is like what you just said, processed foods, like the snacks. Like, and you think, oh, there's healthier ones, like the That's It bars or the chomp sticks, but those are all still processed.
Yeah.
So should we be avoiding those?
I eat chomps every day.
Oh, you do?
Yeah.
Okay, but that's processed.
It is. But it's not, it's like,
It's not Cheetos.
yeah, exactly. It's
No,
not like
No judgment.
Don't
I
hate
know
on
she
my
loves her
Cheetos.
Cheetos. Yeah. But like, so like, because I feel like when you say processed food, like I think of the Soli mango. Like my kids love those. Like,
we love those too.
but isn't that processed though? Because when I
I
think
mean,
of
it's-
processed, I'm like,
When I say processed, I
I
mean
think of
like
packaged.
additives and
Okay.
other ingredients that aren't the actual food that you're trying to eat.
got it. So as much whole
Right.
food, even if it's packaged.
Yeah.
So some packaged food's okay.
Yes.
Just less
Yeah, I feel like
processed.
especially for moms who like don't have time to make fresh things. at home, it's
100%,
Like
like, cut it-
grab the
yes,
chomps,
yes.
grab the Soli.
Okay, what other snacks do you guys eat?
My girls love seaweed.
Okay.
They eat a lot of Soleli bites,
Okay.
specifically the orange flavor.
They'll eat chomps.
They'll eat chomps.
Why didn't we
They-
invent chomps?
I know.
What's
My
your
daughter
favorite
loved
flavor?
Chomps.
Just the original.
The original. yeah.
Smoky barbecue.
Really?
Oh.
It's so good.
Really? I've never tried that. Okay.
Um,
So I feel like there's like so many options, and like how you're saying, like we are in a very Newport little or Orange County bubble of like healthy eating, and there's like a wellness or a juice bar at every corner, but there's a lot of places in this world that they don't have those options. So like there are healthier snacks that you could be getting.
yeah, absolutely. And I feel like it's a lot of fun to start teaching your kids that food actually doesn't come from the grocery store.
Yeah, it comes
If
from a
that makes-
farm.
Yeah. And so farmers markets are great. They can
Yeah.
start talking to people and the farmers and just get to know about that. And it's a fun way for them to start liking fruit and vegetables and all that as well.
Well, then that would be a great time in pregnancy to learn about food so that you can teach your kids how
Yeah.
to properly eat.
Well, and I
food.
feel like pregnancy, it's like so glorified of like, eat whatever you want.
Totally.
Eat for two.
Oh, yeah.
Indulge. Like when I got pregnant, if I was craving something, my husband, he's Palestinian. He's like, oh, if you don't get that, the baby's going to have a birthmark of that. Like, has he ever said that to you?
yes.
I'm like, I'm sorry, what? And he's like, yep, it's happened to, like, he thinks it's happened in his family. And this is like some weird wives' tale that they believe, or him and his family believe. I don't even know if it's culturally. But I'm like, this is not true. Like, you should not be eating ice cream every day. I'm sorry. Right?
I mean,
Like, we
that would
glorify
be
it for
so
pregnant women of
awesome.
like,
I would
Yeah.
love to do
indulge.
that. Yeah.
I know. Well, that
I
is
think a sweet treat here and there is perfectly fine.
Yeah.
yeah. And I feel like that is one of the things I have always said from like when we started filming this podcast is like being pregnant. I have now been pregnant 3 times. And I
Love
said like,
that.
I really don't change what I'm doing. Like I won't just give myself a pass of, oh yeah, you're pregnant. Like go start having ice cream every night. It's still
Mhm.
the same thing of like, if I want it, I portion it out and do and then I feel like that makes you have a much easier postpartum journey. And like everything is just a little more leveled if you don't go to the extremes. And speaking of postpartum, how do blood sugars change for diabetic women like right after giving birth?
This is so crazy. So right after, okay, so you're super insulin resistant in your second half of your second trimester, and then for majority of your third trimester, and then in the last final weeks of your third trimester, your insulin needs go down a tiny bit, but so they're still really high. After birth, you go back to pre-pregnancy, if not a little bit lower than pre-pregnancy insulin requirements. So
Instantly?
instantly
So do
after you
you
give
feel
birth
like
of your
horrible?
placenta. No, you don't. You just like either in your pump settings, you just decrease, or you have like a button that you press that puts you back to those old settings. Or, I mean, if you're taking injections, then you probably wouldn't give yourself the long, I mean, this is like a whole nother topic, but you wouldn't give yourself like the long acting insulin before you went into labor.
Question for you. Your pump, you wear it 24/7.
I do, except when I'm on vacation.
Why?
Oh.
I just like, I like a little vacation from
Love
my
that.
devices.
And
Yeah.
and
And so
that's
I'll just go
okay?
back to injections. I did
Oh, yeah.
injections for so long that
In your
I
stomach?
love all over my body.
All over.
Yeah,
Okay.
yeah, it's good to rotate.
But so the port is like does it ever bother you? Like
Not
when you're
really.
sleeping?
If I lay on it.
So you have to always sleep on the
I mean,
one
it's like
side?
this big. Like it's
It's
not that big.
small.
It's like an egg.
Like when you're driving, it doesn't hurt?
If it's on my back and it's in a weird position.
Yeah.
Yeah.
I mean, that's just so much. Okay. Speaking of postpartum, breastfeeding,
Mm.
how does gestational diabetes, or I'm sorry, T1D or T1 type 1 diabetes, type 2 diabetes, does that change anything with breastfeeding?
For me, it didn't. I didn't experience low blood sugar from breastfeeding. I just experienced like an intense hunger while breastfeeding, which I feel like many women
Yeah.
Right.
experience. I don't know. I hear a lot of non-diabetic women say that they have low blood sugar when they're breastfeeding. I don't know how they know that. Maybe if they test and they see that they have low blood sugar, like,
But
okay.
it shouldn't like affect anything with the breast milk. Like
I
there's
don't want to say it should or shouldn't, but for that just wasn't my
your
experience to have, yeah,
experience.
low blood sugar.
And how do you change your diet when you are breastfeeding? Because you do have to, or from my experience, I've had to eat way more calories in
Yeah.
breastfeeding, like 2 extra meals.
Okay, so for a lot of type 1 diabetic women, they still have a strict eating protocol, or they should follow one, because you don't want your blood sugars to be super high or super low when you're breastfeeding, because it goes through the milk. It can make the milk weird. So you basically need to take good care of yourself, especially if you want to be a good mom. Like, blood sugar swings when you're a mom is really hard. It's hard to mom when you have blood sugar issues.
Right.
It's hard to mom.
It's hard to mom, period.
Regardless.
Yeah.
Adding this on
And
top
then-
of
It's
it.
Yeah.
so intense.
So what do you want women to hear when they feel like they're failing at momming, battling this disease?
Mom, or just women in general?
I feel like moms in general, like moms, like I feel like we have so much on our plate. Like I was 15 minutes late. Like it's like the kids are, but it's like you have this on top of it. And it's like I always feel like I'm failing and I'm not battling a disease. But how do you support women when it's like you are battling your own internal and trying to mom?
Well, and I
Yeah.
feel like moms put themselves last. And in
You
a
have to put
situation of a
yourself
diet, yeah, you have
first,
to
yeah.
put yourself first.
Totally. So I do feel like it can be a blessing, because with diabetes, you have to prioritize your health first. And there's beauty in that, because then that just translates to how you are as a mom. So if you put your health first, your kids are going to see that your health is important to you. They're going to want to know more about your health and their health, and it really can become a beautiful thing. I also think that stress makes everything worse. So to have some stress outlets, again, like we were talking about, deleting social media or taking a break from that, like just anything that you could do to help with stress reduction is going to be better for you.
I was just thinking about
And
this
just be kind
conversation.
to yourself.
Yeah.
Like,
Yeah.
it's okay. It's okay not to be okay sometimes, and it's okay to ask for help. A lot of people living with diabetes like don't like to ask for help, because there's like, I don't know, some weird stigma or shame around it, asking for help. But sometimes I'm like, ask my husband Curtis, I'm like, hey, I need like 15 minutes to come back from this low blood sugar I had. Like, I need your help right now. And he'll totally
What do
take
you
that off
feel
my
when you have
shoulders.
that? Like, is it like lightheadedness?
It's so awful. I hate
What?
being low, but I'll get really irritable, so mood swings. I'll get shaky, I'll get sweaty, my heart rate will increase. I'm confused depending on how low I am. It's really scary.
It's
And how
scary.
often do you experience that? I know it's like different,
It
but
is different. I don't
is
like
it like
a severe
weekly?
low is once in a while, like maybe once or twice a year,
Okay.
like a very bad one. a little mild low can happen sometimes every day or sometimes, yeah, like on a weekly basis. But I
Oh.
really try and avoid going low because it does increase your risk for dementia.
Oh,
Yeah.
wait, how?
So your brain actually needs three things to survive, and that's glucose, stimulation, and oxygen. And glucose obviously
Being blood
is
sugar,
blood
yeah.
sugar. So if you are without a normal blood sugar, your brain like doesn't have the fuel that it needs.
So are
And
you eating around the clock?
I eat
Like
I just like
snacking?
I'm like snack
You
girl. I just like
graze,
yeah,
graze,
yeah,
like
yeah, I
nuts. Like
do.
what's in your bag? Where's your bag? There's
It's
your
right
bag.
here.
All right, do you want to eat?
No,
Like, should
I'm
we be
no, no,
eating?
no,
Like,
no. I'm fine. I'm
you want to? Should
fine.
we take a mid snack? Everyone have a chomp.
yeah.
No, but like you have to think about that. Like it's. I think before kids, I would never have food in my bag. Now, at any given time, like there's probably so
Yeah.
many
Bar.
snacks in my
Yeah.
bag.
Yeah.
But like for you, it's like you always have to have something to keep right.
Yes, yes. I always have low blood sugar supplies on me. So, and snacks for the kids, and I can just usually
How are you
do that
teaching
too.
your kids? Like, I know they're 2 and 5, so maybe the 2-year-old not so much, but like the 5-year-old, are you teaching her yet?
Yeah, so I read her a little book about a mommy who has type 1 diabetes, and
Oh,
it's really sweet. She tries to be like the kid in the book, like wanting to help me if she knows my blood sugar is a
oh.
little high or if it's low. And then my 2-year-old just started saying the word diabetes, so yeah, it's really cute.
Oh
Oh
my
my gosh.
gosh.
When you experience a low, do you notice that there's always like a common factor that contributes to it, whether it's stress that's gotten to you or just like momming too hard or
Sometimes it's just so random. I
yeah.
don't know. Sometimes it could just be like I didn't plan on going to the park and like running around a whole bunch. So it could be something as little as that. Or it could just be, oh, I gave myself a little bit too much insulin for lunch, you know?
And now it's
Mhm.
low.
Yeah.
Can you exercise normally?
I can exercise normally. Yeah.
Okay, that's good. I
Yeah.
mean, that's got to be a good outlet too.
It's a great outlet.
Do you have any friends that have this now? I mean, I'm
I
sure you've
have,
made friends.
yeah, yeah. I don't have friends that I see every day, but I have like a really good friend that I talk to on the other side of the country, and we're always like texting each other
Yeah, it's
about
like
it.
a
So
big community.
it is a big community. There's a huge online community, and I feel like the one of the better ways to help yourself live with diabetes is having some form of community because no one gets it unless you have it,
Yeah.
honestly. Like my husband always tells me like he gets it. He understands. I'm like you will never fully understand.
Yeah.
Like I love you and I love how hard you try, but you will never understand how hard it is.
Okay, so let's talk about your partner because I feel like he's
Yeah, I was
extremely
just about to say
supportive.
that. Yeah.
He
Yeah.
is. Yeah.
First of all, like it makes me so happy that you have somebody that's so supportive and like wanting to understand. And he seems like your biggest cheerleader.
Yeah, he really is. He's great. It's good to have someone that, like, for my blood sugar monitor, you can have people join it to see what your blood sugars are all the time. So
Oh,
he's
so you
one
can
of
have somebody
he's one of
micromanage
my
you.
followers.
One of
No,
my
he
followers.
doesn't.
He's a
He
fan.
doesn't. But he'll check it. Sometimes if I'm not being super nice, he'll just check it and be like,
It
okay.
makes
That makes
sense.
sense.
Yeah.
Oh, that's actually
Oh my
good.
gosh.
I wish my husband had something to be like,
That makes
that makes
sense.
sense.
What was it like with Curtis and like kind of just your journey of explaining what it's like to have diabetes, like when you guys first started dating to kind of creating your family and like how has he grown as your support system?
Okay, so for me, I feel like I always wanted to keep my diabetes private. Even from like I pushed my parents away when I got diagnosed. I was like, I got this, and unfortunately, I don't think they could tell you facts about diabetes. And with Curtis, I wasn't like inviting him in and like wanting him to learn so much about it because I didn't want to like put like any I don't know like
Like a burden. Like,
yeah,
oh,
I
you don't
didn't
have
want to
to,
burden him. I
yeah,
didn't
like you
want to
don't have
burden
to
him.
get to
Like
know
I got
this. It's
this.
like
But then when
enough
we
that
got
I
more
do.
serious, I was like, actually, I need you to learn it and I need you to learn fast about this because if we're in this for the long haul, like you need to understand how crazy this is.
You're like, you need to be responsible as well.
Yeah.
Yeah, I would imagine that it's like you don't want to like impose like your stuff onto somebody until it's like, wait a second, I actually do need to impose this on you, and you need to be like just as much of an expert as I am.
Yeah.
Yeah, that's got to be a whole other set of mindfuckness.
Well, it sounds like now he's just grown to be like an extension of you and being diabetic, which has to be like the best feeling.
Yeah, it's really great to have a supportive partner. There are a lot of women that, or, even men that don't get any of that support and they feel so alone and they don't have any community and it's very isolating.
So I'm sure that like most people wouldn't want like pity from having something like this, but what would you want? Like how could people be more supportive or more like aware of what this is and what you guys go through?
I don't have a perfect answer. I just wish that maybe it was taught more about.
It's not like in school. Like this is not talked about. Did you get this in school?
No, I had never heard
We
of
went to
the
school, the
word
same school.
diabetes before I got diagnosed.
Yeah, that's
Literally
wild.
never heard of the word.
Well, and can I just say, like, I'm just, putting myself out there. I didn't, even when we test for gestational diabetes, I had no idea what that meant.
Yeah,
And I
like
had
it's a
no idea
yes or
what that
no.
meant if I failed the test. Like,
Yeah.
I didn't know what that was going to change for me. I really knew nothing about it. Like, that's why I told you before. I don't think we talk about this enough. And people, I don't
Or
even
at
think
all.
understand the basics of literally what being diabetic means, what glucose is, what insulin is, how it needs to balance, how your food contributes to it. Like, I had no idea.
Thank God we took that algebra test.
Yeah.
Like,
Thank goodness we know X times 2 minus Y equals Z.
Thank God we know pi because we use that all the time. Or what is it? What is the one that you do the math before? What is it? Pandas? What is it?
I don't even
know what that
know.
is. You know when you're like do subtraction before?
Yes.
I clearly forgot that too.
Yeah.
But like all the stuff they don't teach in school, like this should probably be one.
Yeah, or just even basic like anatomy and physiology. I just feel like those should be taught. Like we should know about these organs in our body and what they do.
Please excuse my dear Aunt Sally. That's what it is.
Oh
Do you
my
remember
God.
that?
You are
I
still
do, but I don't
thinking
know what
about
it
Yeah.
means.
Like it's like what you do first in the order of math.
Oh,
It's
okay,
like-
yeah.
it lives rent free in my head, and like I
Parentheses.
wish that I yes exactly.
What is the E?
I don't
What
want
do
to
we
know.
do? Equation.
This is very stupid stuff that we learned in school.
Yeah. No, I was going to say, I feel like this conversation, though, was so helpful because I feel like you took a lot of fear away by just like telling us the honest truth of what it looks like to be a diabetic.
Well,
you know?
and like you feel like, okay, I'm gonna speak like put myself out there. I feel really dumb not knowing.
Same.
And like asking like what is the difference? And I said, like, can you tell me for kindergarten level? I meant like
Like, for
my
us.
level. Like, can you help me understand like the difference between
I hope I was able to do that, by the way.
No,
you
you were.
were.
But like, and I even went, I think I talked to you about this. Like, I went to the T1D charity event and like we've gone a few times and like supported, but like, and part of it for me is like I go up there and I hear these kids talking. I'm like,
So sad.
it's so horrific and sad of like what these kids battle.
Yeah.
But I felt so ignorant, not knowing or having any idea. Like my girlfriend Lacey brought me into the charity and like I had no idea any of this stuff beforehand
Yeah.
as a 30-something-year-old woman. And you feel very dumb not knowing.
I think we're getting to that point in our society and just in our country with all of the health issues that we have that it's going to be really rare for you not to know someone without diabetes.
Mm-hmm.
Well, and how common is it?
So type 1 diabetes isn't super common, but type 2 diabetes and prediabetes is extremely prevalent. And then gestational diabetes alone can affect up to, it's the number one complication of pregnancy.
Really?
Yeah, affecting I think it's up to 18% of.
Oh, wow.
Women.
That would make sense. Like I know two people.
I know someone for women who do experience gestational diabetes, like
Mhm.
after they deliver the baby, is it
Yes.
immediately done?
Most of the time. So the weird thing about gestational is you could only be tested at weeks 24 to 28, but maybe you had prediabetes or type 2 diabetes before and you just weren't diagnosed, but they were able to find that you had gestational diabetes. And so that's the one that's likely not to go away after you've given birth. But having and getting diagnosed with gestational diabetes, you are at a huge risk of developing type 2 diabetes
later.
Really?
within 5 to 10 years after giving birth.
Oh,
Mhm.
shit.
So they check you, I think, like at your 6-week appointment, they'll check your blood sugar, make sure that you're not having blood sugar issues anymore. And then you should just keep following up every
Monitoring.
year. Yeah.
What is the one that is genetic? Is there one that's genetic or no?
There's
it's type
all
1 or type-
genetic component with all types of diabetes.
There is.
Mhm.
Okay. So, but like, do you have anyone in your family?
No one.
But like, so I'm thinking selfishly, like Gus's mom has type 2 diabetes. Like,
Mhm.
do I have to worry about my kids? I mean, I have to worry about my kids regardless, but like, could that be passed down?
It can.
It can.
Yeah. So if you have a history of someone in your family that has type 2 diabetes, that increases your risk for developing gestational diabetes.
Got it.
Yeah.
For women who are diagnosed with gestational diabetes in pregnancy number 1, are they automatically going to have it for pregnancy number 2?
No.
But you had it. Well, did you ever
Before,
have
during, and after.
Yeah, she's like, I still have it, lady.
But so if you have it before pregnancy, like you automatically have gestational diabetes because you already had diabetes
Yeah, so gestational just means you get diabetes during
pregnancy.
pregnancy.
Okay.
Mm-hmm.
So interesting that you can have it with one pregnancy, not have it with the next pregnancy.
Yeah, and with gestational, so you can manage it a lot of the time with diet and lifestyle, like I said. Then there's people that manage it with metformin, which is like just a pill.
Oh, and
that
people are taking metformin for other reasons.
yeah, it's
What do you think about that? My mom's boyfriend takes it.
Yeah,
gonna
Not
call him? Like,
calling
No,
him
no,
out
I
on the
mean,
podcast. Oh my God.
there are a lot of people that take metformin for
Wait, that and ivermectin, or no, not ivermectin. What's the other one? Ivermectin, I know, but wait, there's another one that people are taking for like longevity.
I couldn't tell you.
Is it metformin that people are doing for longevity though?
Yeah,
Does that work? Like, is it?
I
Would you recommend it
I
off the record?
I don't know. I don't know.
Yeah,
I don't
doesn't
I don't see that I don't think it can harm you from taking it.
Really
Yeah.
interesting.
And anyways, it's safe to take during pregnancy, even though it crosses the placenta and there is a little bit of a risk to the baby being
Wait,
delivered
we have not talked
early.
about GLP-1s.
I can't.
Tell
Oh.
me.
No,
Ooh,
I
I like
can't.
this. Oh, you can't? Like legally, you can't?
I mean, I just with type 1 diabetes, there are a lot of type 1 diabetics that do take them
And
they
you think it's a bad idea?
I don't think it's a bad idea. Honestly, I don't spend too much time researching that. I think that with type 1 diabetes, we don't have that hormone that tells us that we're full. So we could eat endlessly. Like my stomach is an empty pit. So
Really?
having that helps you feel satiated taking that drug. And
You
that's
don't
why
have,
it
wait,
works.
is that true though? You don't have the hormone?
Yeah. I don't have it. Type
Do you
1
see
diabetics
that
don't
like
have it.
right now we don't even know the basics?
That's crazy. Do you feel
That's
like
crazy.
you're talking to somebody very like I don't even know that. So your body lacks the hormone that tells you you're full.
Mm-hmm.
So how are you able to control that? Like if you eat an apple,
you're like
you
a
just tell
very
yourself, okay,
fit
that's it
person.
for
I mean,
today.
I still I get full.
You do.
I get full. It's not. I think, yeah. There's like I honestly I could eat a whole extra large pizza by myself though too. I just like tell myself that I'm full.
Are you ever like, F this disease? Today I want to eat an extra large pizza.
Yeah, but I will cover
But
myself
then you'll
with a whole
pay
bunch of
for it.
insulin.
Oh.
Yeah, and there's different like hacks and tricks to be able to eat food like that. Like you could split your doses. I mean, I've lived with it for so long. Like I feel like I have a trick for every
How have you learned your tricks? Like, has it been
trial and error.
Of what
okay.
makes you feel good and what makes you feel terrible.
Yeah. And there's just certain
And do you
foods
share
I like
that
to
in your
avoid.
practice of like
Yeah.
this
Oh,
is
definitely. Yeah.